You are officially invited. Yes, you're invited to join us in Fertility Awareness Mastery. This is my 10-week program designed to help you gain confidence using fertility awareness. Whether you're actively avoiding pregnancy or looking to optimize your cycles for conception, we have a spot for you. We start on January 22nd. Are you ready to jump in? Head over to fertilityfriday.com/group program to reserve your spot today. That's fertilityfriday.com/group program. This is the Fertility Friday podcast, episode number 232. Welcome to the 232nd episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. I'm excited to share today's episode with you. In today's episode, we're actually welcoming back Dr. Danielle Miller to the show. Dr. Miller was the very first doctor that I brought onto the show, and she actually specializes in NaPro technology. For those of you who've never heard of NaPro technology, it's an incredible type of medicine where doctors are actually trained in the menstrual cycle. And so you're dealing with a traditional medicine doctor who is aware of the menstrual cycle. And especially if you're dealing with challenges with fertility or the menstrual cycle, they'll actually test you based on what is happening in your chart. So it's kind of like the fertility awareness world meets the medical world. So if that sounds interesting to you and you haven't listened to episode 31, definitely go back and check that out because it was really a fascinating interview. In today's episode, though, we're actually talking about something completely different. Danielle is sharing her birth story with us. And actually, Danielle has had 3 children. So it's an interesting perspective because, she's a doctor. So she learned all about birth from the medical perspective, but she's also a mom of 3 children. So she's experienced birth 3 times, and her experience of birth was different in each time, as they all are. And it's really interesting just to hear her experience of kind of knowing all the things and then going through the things and her reflections on that. So I know you're going to enjoy today's episode with Dr. Miller. And as you heard in the introduction, registration is now open for Fertility Awareness Mastery. We will be doing a session in January, and we're going to be starting in mid-January. And there are a limited amount of spaces available. I'm only planning to do 1 group. And so those spaces fill up fast. So if you're wanting to join us in January, make sure to head over to fertilityfriday.com/group program and send in your application. And let's just make sure to get you registered so we have a spot for you in January. So again, that's fertilityfriday.com/group program. Now let's go ahead and jump into today's episode with Dr. Miller. So I'm very excited to welcome my guest, Dr. Danielle Miller, back to the show today. So for those of you who've been listening to the podcast for a really long time, or those of you who have binge listened to nearly every episode, you may remember Dr. Miller back from episode 31. So Dr. Miller is a board certified family physician, and she has also had additional training as a Natural Procreative Technology Medical Consultant. That's a mouthful. So as a NaPro physician. And so in our first episode together, we really talked about the application of NaPro technology, which I always refer to as this amazing alternate universe where doctors use menstrual cycle charting within the medical protocols. But in today's episode, we're actually going to be talking about a completely different topic. We're going to be talking about birth. And what I'm really excited to chat about is just from a medical doctor's perspective, who not only trained in how to manage birth medically, but has had 3 children herself. So without further ado, welcome to the show, Danielle.
Thank you so much, Lisa. Thrilled to be here.
Well, thank you so much for coming back on the show. I'd love just to start with, to kind of orient our listeners to the topic. When we've been in contact, I think we mentioned in our pre-chat, it's been maybe 3 years since we did our first interview. A lot has happened since then. We both had additional children and a lot of time has passed. But I would just love to hear because it was interesting that this was the topic that you wanted to tackle on the show. And I thought, well, how does the kind of connection between learning about birth and in textbooks and in your medical training versus having children yourself, I feel like we should start there at just how the actual experience of having children has changed your perspective on birth.
That is such an awesome question. Thank you, Lisa. So I think we had been in touch intermittently over the last 3 years since our first interview when another mutual friend and past podcast guest. Shout out to Colleen Flowers, who put us in touch years ago. We've been in touch intermittently, and I mentioned my third birth was sort of this catastrophic change from not only my historic previous two births, but also it felt like the most opposite experience from everything I learned in medicine about managing pregnancy and delivery. And so I mentioned it to you, and then you said, "Oh, I'm thinking about a birth podcast," and you invited me. So thank you for that. This third birth was really sentinel to me, not just as a mom and a woman, but absolutely sentinel to my experience as a physician, providing maternal child health to moms and babes all the time. As you mentioned, I have delivered kids as a doctor. In my training, I delivered about 100 babies, often to women who I cared for before and through their pregnancy as well, which was so special to have what we refer to affectionately as continuity deliveries, people who you know, and then they go into labor and you get to show up and be there for their birth, which is just phenomenal. But yeah, this third birth required a lot of unlearning for me. I remember when I had my first child, as soon as she was out of me and I was recovering with my sort of traditional, typical, average hospital birth, that it occurred to me very quickly in those first hours and days that I wished I could have redone every single prenatal visit and birth that I had done before she was born. You know, I felt like, gosh, I'd learned so much in this process of laboring and delivering. I wished I had redone 3 to 5 years of medicine before that, but I couldn't, of course, do that. It so impacted me. And then I had my second child. The delivery was much like the first. It was a full-term, thankfully, a full-term healthy vaginal delivery. It was also medicated with an epidural. And I had really been seeking something else that whole time before those two experiences and through them. And then I had my third baby, which was not medicated. We'll get to the story later, perhaps. But after that third baby, again, just like my first, it was just an experience of, oh my goodness, I wish I could redo. Truly, it was almost like every patient encounter I'd had as a doctor the last 7 years. I just felt so sentinel for my understanding of who we are as women and who we are as people. It was a really awesome experience. So a way I described it to a group of young doctors recently when I told this third birth story, I said to them, as a young doctor, I learned how to obstetrically manage women in labor and safely get on the other side of that delivery. But after this third birth, I learned what birth is, which is a very different thing than managing someone.
Wow. Oh, I can't wait to dig into that. So you mentioned that you learned what birth is. So now tell us what birth is and how it differs from your medical understanding of birth prior to it.
That's such an awesome question. I thought I prepared for this, but that gives me a whole new perspective. So I believe that birth, also I have a friend who's a doula. She describes birth as having a lot of corollaries to death. I think that may also be true. I believe that birth is a culmination of who we are as people and where we are in our lives to some degree. I don't want to put so much emphasis that this is a downer for anyone, because birth can often be a disappointing experience and a difficult or dangerous experience. But I do think that there are pieces of birth that most women can relate to that can be really beautiful, such as, who did I choose to have in the room? And who did I choose to attend my birth as a medical provider? And who did I spend time with in those days when I was waiting to go into labor? And who did I spend time with in the days when my baby was so brand new and didn't even have a bath yet? And who did I talk to when I was pregnant? I think that as women, we tend to be relational, which is so beautiful. It's such a gift to us, I think. I think being in relationship with other women is such a beautiful thing. So birth can bring out a lot of that. There's showers and all sorts of crazy stuff we do sometimes, and a lot of anticipation. We all know that it will be life-changing. We don't really know how. So yeah, I think birth is a little bit of who we are in that moment and where we're at in our lives. And then, of course, it is sometimes very medical, based on need or not need. And that was a lot of the unknowing I had to do, because I'd had two experiences that were really not tragic. I don't want to say they were, but they were not what I had anticipated. And I think a lot of women have that unanticipated birth. It just is different than what they planned or thought. Yeah, so just learning that birth, like death in a way, is a very normal thing that each of us will experience, if only through our own birth, through our mom's bodies. We all got here somehow. So birth in a way is the great equalizer. There's a lot of regard in human physiology and medical school for how intricate and amazing the body is. As we mentioned in pre-chat, you've got respiration and digestion and cardiac output and all these really cool things. The immune system is a really neat part of the body as well. There's a lot of awesome things that happen. And birth is also a physiologic process. And so there's so much medical training and medical attention around birth intervention. But birth as a physiologic process is something I feel like I finally understand it, which is really awesome. And having experienced it with a lot of patients, being the moms birthing was really a gift. And being a medical provider is totally a privilege that I appreciate very much. But understanding it in a new way is also a gift.
Mm-hmm. Well, and you mentioned that, after having gone through even like your first birth and then your third birth in particular, that you would have, all of a sudden it was like, oh my goodness, I wish I could kind of redo all of those experiences. So tell us, what are the biggest things that you wish you could actually go back and change in how you were managing your patients?
Yeah, I think if we regard birth as a normal process, that changes a lot of things. And if we regard a woman's response to her environment as normal, and we sort of think about why she is afraid or why she's in pain or how we can support her through fear and pain, I think that would have changed a lot of my ability to, I've always enjoyed being present with a patient, really try to do that when I'm in an exam room or a, delivery or other situation. I always tried to do that. I don't deliver babies anymore. That's a privilege that I gave up when I wanted to be a grown-up doctor and have a little bit less responsibility with that type of duty, because it is very demanding in terms of nights and weekends and all that. And also demanding because it can be dangerous and scary. And, that was a choice that I made to work in the office after my training. But yeah, I think if you understand the normal, this is what you talk about on the podcast all the time. It's what I think about every day at work. If you understand a normal menstrual cycle, then you can understand what's going wrong with the menstrual cycle or the fertile phase for that matter, or the luteal phase, all those things. So birth is just like menstrual cycles and fertility, in that there is a normal balance and a normal process. And then if you understand that well, things that vary from that generally normal, safe process, it's a lot easier to understand what else can happen.
Mm-hmm. Well, something that I picked up in the way that you just described it is it's kind of like the fundamental flaw. So in my, I don't know if it's like non-objective opinion, but like the fundamental flaw in the way that kind of the medical model views birth as a problem or as a medical emergency, as opposed to looking at birth as a normal and natural process that can happen without any problems. Like, it doesn't always happen without any problems, but it can happen without any problems.
Yeah, I think there's a difference between preparedness and expectation, and I think you can be expectant towards a healthy outcome, but be prepared for an emergency as opposed to being expectant for an emergency,
Yes. I'm thinking of how we could delve into that a little bit more. So I'm not sure if I've spoken about this on the podcast, but I have a lot of friends who are nurses. And when you have friends who are nurses, I think I probably have said this on the podcast before, like, they have no filter, like, they see so much stuff, and it's just like, you really, like, if you don't have a strong stomach, I don't know if you can hang, but like, they just talk about a lot of things. But I went through a lot of interesting experiences. Some of my best friends are nurses, and just the way, even their own experiences as women. So the way that they looked at birth prior to actually having children themselves, it's in a way very similar to your experience of looking at it in one way and then actually going through it and being like, oh, I get it now. So I suppose the question that comes out of that is, I suppose, how, as experiencing birth and experiencing just the process of it, maybe this would be a good time for you to share with us, whether you want to share your third birth, your youngest child's story, or if you wanted to talk to us a little bit about how it differed, kind of the unmedicated versus the medicated, and how that changed your experience of or your understanding of what birth is.
Would this be a good time to maybe mention a few resources? Is that all right?
Oh, yeah, for sure.
Yeah. So I did a little bit of prep for my first birth. I wanted to be the patient, not the provider, which I knew was going to be really hard for me because I would know what all the beeping in the room meant, and I would know how to read the monitor, and I would know if they were whispering doctor, nurse talk, what it all was, what they were talking about. So I wanted to get in the patient mindset. So I did take a Bradley course, which was, I think, a fair course. It didn't resonate with me at the time. I'm not sure. I think I wasn't ready for taking it on to the depth of my bones. And maybe the style wasn't a good style for me. I love to read and I love to learn and think. But what I took from that course, which was awesome, was that is it Bradley diet? Yeah, Bradley diet. So I looked at food in a new way in that first pregnancy. And that was an awesome gift to me, to realize that what I ate might impact the pregnancy outcome and the birth outcome. That was totally new. I learned nothing of that in my medical training. We always talked about babies being large or small for gestational age, and never once discussed maternal diet in regards to things like that. And what the Bradley diet focused on was research, I think from the 70s or 80s, by an obstetrician who found that women consuming 80 to 100 grams of protein per day in any form, regardless of maternal weight gain and pregnancy, that they had less preeclampsia, which is an awesome bit of information that really doesn't hit medical mainstream. So that was an interesting experience. I want to mention a couple more resources that I really got into in my third pregnancy that kind of did that sinking into the bones thing. That was so key for me. Firstly, I took self-care to a whole new level. I was really knocked down and tired after delivering 2 kids in 21 months the first 2 times. And so during my third pregnancy, I didn't want to crash. I wanted to take care of myself. And that was kind of new. I think like a lot of women, life happens and we get busy and we've got things to do and we want to have some fun also. But I really shut down every night around 8 or 9 o'clock, and I took a bath almost every night of my pregnancy. I did not boil the baby. I kept the water low. It wasn't scalding above where the baby lied. I know that baths, like anything enjoyable in pregnancy, must be limited.
Apparently.
Yeah. So, there's so much miss or bad or difficult information. No wonder pregnant women don't eat and relax. So self-care was huge. And then what I did a lot during those baths is I did listen to another podcast. There are a few. I enjoyed Bryn's Birth Hour. I listened to hundreds of women. I think it was over 100, but each of them often had more than one story. I listened to their birth stories. And that was so different than delivering 100 babies. Listening to about 100 women, it might be the opposite of delivering 100 babies, because as a medical provider, I could hear what they were describing in a medical context, but what they were teaching me, which I didn't learn as a medical provider, is the experience of birth. I sort of had my 2 experiences, and 2 is not a lot in terms of trying to figure something out. And so I think those women really taught me so much. And it was just really beautiful to let those stories literally soak into my bones. I often fell asleep in the bath while listening to these stories. It was just a phenomenal time of relaxation. And just, they taught me what a normal birth is, both if there was a complication and there wasn't, but still what was their body and what was their heart and mind doing. It was just an awesome experience. I reread, I think for the 3rd time, Ina May Gaskin's Guide to Childbirth. And she really filled in a lot of the gaps for me, both as a patient woman going through this birth and pregnancy, but also as a provider. She, as we were discussing in pre-chat, like a women's intuition. I think Ina May Gaskin is not only very skilled and very knowledgeable, but I believe that she uses intuition to guide her interactions with the women. And that is something that is not considered in the medical model, perhaps. And so, things that she taught me as a medical provider, that the cervix is a sphincter. It's not a machine. We think of the uterus and the cervix as a machine, the 3 Ps, the pusher, the passenger, and I forget what the 3rd P is. This is embarrassing. I haven't delivered a baby in a while. Power. which is the uterus, I think, right? And then I probably messed up the P's, but anyway, she describes the cervix not at all about this mechanistic machine, but she describes the uterus as a sphincter. So, kind of an interesting, perhaps hopefully not TMI for your audience, example that the uterus is a sphincter. For example, if you're constipated, we don't tell people to just push as hard as they can when they're constipated. There's some coaxing and some negotiation in terms of having a safe, hopefully not too painful bowel movement, right? So, sphincter, like, oh gosh, the cervix is a sphincter. Nobody ever taught me that in medical school. This is amazing. And then there was 2 other resources that I thought were just totally blew up in my mind in this process. One was the fear, pain, tension cycle. That is discussed in the midwifery model of learning. It was never discussed in my medical training that I remember. Perhaps it was, but I certainly don't remember. So the idea that fear and pain, fear causes tension, which causes pain, which causes fear, that type of cycling, and that it snowballs in that way. So there's this fun online lady who has like Birth Like a Boss stuff, some videos about this. And I think there's some midwifery literature about fear, pain, and tension. So that was really interesting to me. And the last, which I considered before I delivered, novel concept, I considered my postpartum recovery. And there's a book called The First 40 Days, which was phenomenal. Really thinking, particularly again, you don't know what you don't know. I didn't know how hard recovery would be. And then twice it was more than doubly hard after the second, I think. But then I sort of went into this third pregnancy wanting to recover better and well. And the First 40 Days book was something I latched onto. I wasn't open to it before, I don't think. Setting aside those first 40 days for rest and recovery and bonding with the baby. My head wasn't there the first 2 times. I think my head was spinning. I forget where your question was, but those are the resources that really stood out to me, Lisa. Where am I at? Am I off track?
No. I think I think it's really fascinating for me. So I'm sure it's fascinating for the audience as well. Just when you described your process of kind of going from doctor, going from MD to patient. And I thought it was really interesting how intentional you were, because you knew you would have a hard time becoming the patient. And so how intentional you were in terms of trying to get yourself into the patient mindset. And also what's fascinating is how different that is, and how experiencing birth, even via other women's birth stories, gives you a completely different understanding of something that you've already attended 100 times. Safe to say that the majority of the listeners have not attended 100 births and will never attend 100 births. Like, I will never attend 100 births in my entire life. Yeah, you never know. I could wake up tomorrow and change professions, But I think that's really interesting. And so, did you want to take us through your third birth and tell us kind of how that experience differed from your first 2, and like how that's brought you to the kind of the knowledge and wisdom that you hold today?
This is exciting. I get happy every time I get to tell it. And people want to know, which is kind of fun, because I think, like a lot of things in life, you want to share, but you don't know if anyone actually wants to hear it. So thanks for asking, Lisa. So I'll quickly tell my first 2 birth stories, which unfortunately for my daughters, they're almost identical. I feel like they get a little jealous of their brother's birth story. But so my first story with the first 2 was, again, mothering is a balancing act. So I wanted to deliver and get delivered around my due date because I had to go back to work. I chose 10 weeks later. And so there was a lot of pressure going into the birth scenario, even though I wanted it to be, quote, perfect, whatever that means. So I had my membrane stripped around my due date, I think on or just after my due date for each of my first 2 births. Membrane stripping is when the sac of water is pulled off or separated from the lower uterine segment. It's done during a manual vaginal exam in the office with your provider. And it's not required. Some providers push it, some don't. I liken it to pulling the skin off the breast of the chicken, if people are looking for a visual, if that's too much information. I'm sorry. But women are like, how do you do that? Anyway, that's how you do it. You get your fingers in between the 2 and spread them apart. But so I did that twice, and it did bring on labor within a couple of days, which is the whole point of the procedure. My first 2 labors, once the contractions started and got regular, there was literally no break in between. And if you look on the monitor, it was mountain and mountain and mountain, and there was no space. And what that meant is that I was in constant, in those two experiences, pain. And the pain was quite severe. I went to the hospital when I could not manage at home anymore and asked them to check me. And it had been some or many hours. I don't recall the details, but it had been a while. And the smug nurse, it was a different nurse each time, but it was someone who I'd worked with as a doctor in the hospital delivering babies. So they knew I was a doctor. And they checked my cervix and smugly told me that I was 4 centimeters twice each time. and that experience of a woman looking down on me and thinking of me as a big wuss, as not that far dilated, it really did impact me. Only in retrospect did I realize that. At the time, I just felt kind of stuck and just kind of choiceless and just kind of disappointed because she thought I was a wimp twice, and that was tough on me, I think. And it also made me feel
I just want to clarify in case the audience members aren't, because I mean, I've been through birth, so I know what you mean, but it's like 4 centimeters dilated means that you're not really, like, you haven't really progressed to the point that anything's going to happen yet. And so if you're in this much pain, not handling it well at this stage, how are you going to handle it at the 10? So I just want to give some context for listeners.
Thank you. I forget people don't manage birth every day, just like you said, Lisa. Thank you. Yes. So I was a wuss at 4 centimeters. So how was I ever going to get to 6 or 8 or 10? That's exactly right. And that was where my mind was, because even though I'd taken that Bradley class and tried to read a lot and tried to read on MA, I was just a patient just trying to get through this experience. And 4 centimeters was a huge disappointment. So I hung on as long as I could twice. It really felt like the same birth story twice. And I waited and waited and waited. And the pain just became monumental and it felt irrevocable. And it felt like nothing was changing. I remember crawling. I was on my knees in the bathroom floor of the hospital. And next to this drawn tub, because I was going to try to relax in the bath, I put a toe in the water. It felt like burning fire fumes of hell. It felt too hot. It was uncomfortable. Anyway, I didn't even get in the bath. The whole situation was not what I planned. And I remember crawling up my husband's leg, pulling on his gym shorts, being like, "Tell her I need an epidural." And him being like, "You told me you didn't want one. Are you sure?" I was like, "Get her now." Just fuming at him also and just hating everyone. Anyways, each of the times I got an epidural, my cervix, I pretty much was fully dilated right away. I only realized this in retrospect, but I believe my inability to relax due to the constant frequent contraction pain, I was like a stone's throw from actually being fully dilated. I didn't know at the time, but I think for me personally, my body hits transition around 4 centimeters. Transition is the peak of intensity of any labor. And so most women hit transition between 6 and 9 centimeters. I think in retrospect, I hit it around 4. So I had my epidural each time and then was pretty much fully dilated soon thereafter. And I delivered these great kids. And it was not, once the pain was gone, I had no fear and there were no medical complications. And that was a gift.
Can I ask you a question?
Sure.
Okay. So I'll just give the context that I asked the question because I want to know what your thoughts are on this.
Uh-oh.
So I don't know anything because I'm not a doctor, right? So I in terms of birth. So when I was going into my own pregnancy journeys, I had to learn everything and take classes because and I remember my midwife saying something to me. So she explained the difference between how much the cervix dilates. So we, from 1 to 10 centimeters or whatever. And she talked about what it means to be effaced. So the softness of the cervix. And so, so I remember at one point in my first birth when I called the midwife, I called her when she told me to. So when the contractions were so far apart for so long, blah, blah, blah. And then I remember she came and she said, "You're 5 centimeters dilated and fully effaced."
Mm-hmm.
And so I knew that meant that I was it was go time.
Yeah, right. Because you were really thin and you were just going to expand pretty quickly probably at that point.
So I'm just curious, just given your story, because what you're saying to me, being that, I think I go, 4 centimeters, I was in transition, it was obviously further along, you weren't forced, it just made me think, could you have been effaced? I don't know.
Right. So there's this funny thing in medicine where knowledge and information is not always given to patients. So I was a patient and they told me I was 4. They didn't tell me how effaced I was. I never even thought to ask. Like when you're in the moment, you can't think. No. You just do.
Oh, I didn't ask. She volunteered that.
Yeah, and you know why she did it, Lisa? She did it to empower you and to let your brain know that you could do it. I was in a situation with a nurse who looked at me and thought I couldn't do it. And she knew I didn't want an epidural. That was what I said when I walked in the room. And then she thought I was pitiful because she thought I, quote, needed one. She never told me, neither of my nurses on that initial cervical exam in the triage area of my OB hospital, neither of them told me how effaced I was. I never even thought to ask. And I'm not sure I've ever even thought about it till you just asked me.
Well, that's why I wanted to ask. And so just again, in case the listeners aren't sure what it means. So like you think of your cervix as a fist. We'll just go with that for now. Sure. And as you dilate, it has to thin out. So it goes from a fist to a pancake. This is not
piece of paper.
Piece of paper. Okay. Yeah. See, thank you.
But that's really thin.
But if you start with a fist, so if you are like 4 centimeters dilated and you're down to a pancake, it means that you have much less to go. So the concept of this linear, like 1 to 10, it can, like in your experience, Danielle, it can make you feel like, oh my gosh, I'm not even halfway there. And I still have like the same amount of time it took me to get to 4, more than that to get to 10. Whereas again, this is like that knowledge is power, like informed choices, blah, 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 like what we're always talking about on the podcast. But it's like, if you have that different understanding of your cervix as a sphincter, or this understanding that it goes from a fist to a piece of paper, like the fist is not accurate, but you're picking up what I'm putting down here.
Yeah. It's pretty thick.
Yeah. Like then you know that if it's, even if you're 4 or 5, but it's like flatter, then
you've got a paper thin cervix, you're almost in the go zone.
Yeah, it's not like you have 50% of the journey left.
Mm-hmm. That's right. Yep.
So that was like an aside. So I do want to circle back to your story. So then you did have the epidural, and it's so interesting how you described it, because then you were able to relax and everything just happened. So tell us what happened then, and then how that differed from your third birth story.
Yeah, I mean, that's the whole story. Is I had an epidural. Actually, with it's hard, the memory is a terrible thing. With one of my first 2, my husband and I argue about which one. With one of the girls, my bladder was full. And they actually took over 1 liter of urine out of my bladder after the epidural. And then I delivered right after they took 1 liter of urine out. I kept telling the nurse in triage, the smug nurse, that I had to pee. And I kept trying. I tried 3 times in that damn restroom to pee, but my uterus kept contracting and I could not pee. And my regret with that birth, so terrible. Sorry, girls. My sort of bugaboo with that birth is that if someone had just offered, I mean, they heard me saying I had to pee and they never helped until I had the epidural in. And the only reason they, quote, helped then is because it's pretty standard to catheterize someone after an epidural. I don't think they were helping me personally with my need at the time. But if someone had offered to catheterize me and I had urine output of over 1 liter, I mean, God, maybe I would have just delivered in triage. Who knows? I mean,
yeah.
It was one of those things of really not listening to the patient. And I think there's sort of this, this hysteria thing with women's health where they kind of saw me as a hysterical woman, and they weren't really picking up on the trail of breadcrumbs I was leaving of, hey, I think my bladder's pretty full. Because I had my Bradley training behind me. So I kept eating and drinking before it got painful. And then I forgot to pee because I was distracted by my labor. And so my bladder was really full. Oh. But anyway, so those were my first 2 births. And I'm thankful. And, a big fear that I had was I wanted to deliver vaginally. So I was grateful for that opportunity. And then I felt so good that I just was crazy busy and crashed. And I did not rest because I thought that only weak women needed to rest. And I felt fine, but you don't know what you don't know. And so the third time around, I really wanted it to be different. I actually, quick side note, just in terms of picking a provider, I did transfer my care more than midway through my pregnancy based on the anatomic ultrasound, which is typically done around 20 weeks. There was what we in the medical community call an incidentaloma. meaning something came up abnormal by accident. And then in the end, my incidentalloma was actually a false positive. I was so concerned about the management and the discussion around that management. They told me I might need to be induced, that I transferred care. So part of that was me knowing I had to transfer. I was also thinking about those triage experiences and wanting to get to a different hospital. And I asked my friend who's an OB what she would do with this ultrasound finding. And then I transferred to her hospital. And she said, well, I'd let you go till maybe your due date. And they had told me at my previous office 39 weeks. And I said, okay, well, that's better than anything else I got going. I'll transfer to you. So this time around, my two specific changes that I deliberately made were I did not want to be induced or have my membrane stripped, like nothing to push the baby towards delivery, if at all possible. So I really had to advocate for that, which turned out later in pregnancy at this OB group, if the doctor manages you to the end, they let you go till like 40 and 5 or 41. But if the midwife manages you in the same group, they'll let you go to like 41 and 2 or 41 and 3, which is sort of wild. So I just stuck with the midwives at the end. And then it's like picking your provider. I think a lot of women don't realize your provider can really impact how you deliver. I think a lot of women don't know that, but I knew that. So I kept fine-tuning my provider choices. And then the other thing, I didn't want to be induced and I didn't want to have my membrane stripped. I guess that was it. I really wanted to go into labor totally on my own. I felt like a very silly woman that it was my third baby and I never gone on my own. So I wanted that experience. So that was pretty exciting. I just wanted that. So I figured, well, if I had my membrane stripped around my due date and I delivered then, maybe on my own, I'd go around 41 weeks. That was just my anticipation. So I finished my last day of work on my due date. And I was stoked because I still had childcare during my normal work hours after that day. So I had like a couple days to clean my house. So I did. I cleaned my house like crazy for 3 days. And then on Friday night, oh my gosh. Yes, nesting. And I really, truly did not nest until after my due date, which is pathetic, but that's just how it was. That was just what I could do. So I nested, and then I felt like on that Friday night, a few days after my due date, like, man, I was doing a Monday. I thought, if I had the baby tonight, I'd be okay with that. And I really was not okay. I was very fearful. I really didn't want an epidural, and I was fearful that I wouldn't be able to, quote, hack it again, whatever that means. All these pressures I put on myself. And so it was a lot of like mentally letting go. So Friday night, I was kind of sort of okay with the idea of going into labor. But then for the next 3 days, like Friday night, Saturday, and Sunday, I increasingly was like, okay, we're approaching 41 weeks. Like I might go into labor at some point. And I just had to let it go. Like, I can't control this. I mean, I was hitting these birth like a boss, Ina May, birth hour stories. I mean, I was hitting them hard, Lisa. I just had to let go. It's funny because you want to influence it, but you kind of have to let go. I don't know if you have any comments on that. That was my experience.
Well, I mean, I would just say that, well, first of all, I went into labor 2 weeks early each time.
Yes.
So the first time I didn't know I was in labor for the first half of that until I knew, right?
Yes, until you can't unknow.
My water I never had the experience on the movies of your water breaking or anything. Like my water apparently breaks shortly before the children come into the world.
Yeah.
So I never had that even as a heads up type of thing. But then I took a hypnobirthing class. I've talked about that on the podcast before. And although the name might sound a little bit wonky, it's really like an exercise in mindfulness.
Yeah.
It teaches you about your body and your muscles and what happens in birth. And it gives you a tool. So from a practical standpoint, it gives you something to do so you don't freak out when it starts to hurt. And for me, having like the meditation, like the breathing through it, that was the most helpful thing. I feel like the most helpful tool I had during it. I'm not sure if that is helpful, but.
Yeah, I think what I noticed from what you said is, first of all, you mentioned that there's so many ranges of normal within birth. Some women's water breaks first, and then they start contracting. Other women, it breaks right as the baby's coming out. Some women have their cool, which I always thought was amazing, lotus birth of their baby born in their bag. That's like a fun thing that I kind of hoped for, which didn't happen, which is fine. But Because that would be the coolest thing to visualize. I've never seen one. I mean, it'd just be cool to see. Now that I don't deliver anymore, I have to like do it myself, right? To like see anything cool in that way.
Yeah.
But yeah, there's a whole range of normal, and you didn't know how your normal was going to go, and you thought it might go one way. And then, yes, another friend, she told me with my first, she was totally right. I mean, she's just such a wise woman, also a family doc. She does deliver babies still, vaginal and cesarean, actually. And she sort of is very in touch with her body and women's bodies. She said to me, Danielle, you need something to do when you're in labor, which I think is what you're speaking to.
Yes.
But you had a mindfulness.
Something to do. Yeah.
Yes.
So that it's literally the strategy. I would call it, don't freak out. Like that's the strategy.
Well, so Lisa, I didn't have anything to do the first 2 times. So what did I do? I freaked out.
Yeah. And then you couldn't relax. And that's what I really liked about so when you said the fear, what did you say? The fear, pain, tension, or the fear, tension. Yeah. Fear, pain, tension.
Yeah. One of those two.
So hypnobirthing attacks that because they tell like the whole point of like the whole point of the modality is to stay calm and to keep your body loose and relaxed. Like that's the whole point of every exercise you ever do.
Because that is the opposite of what we do impulsively in birth. But it is the wisdom of birth. It really is a wise thing to do.
Well, it's scary, right? Oh, birth is scary. It's scary.
You don't know if both of you are going to survive. Let's be honest.
Baby out of your vag. Like it doesn't feel like it doesn't tickle. So you need to have something to do to help you to stay calm and to stay relaxed. If you intend to, birth, unmedicated, then you actually need to have a strategy for pain management.
I think everyone needs a strategy, even if it includes pain management. I think there needs to be some appreciation for normal birth and some appreciation for what the heck I do before, during, and after the pain, before I'm with my provider, when I'm with my provider, right? I mean, or nurse or whatever. Yeah. So I just this weekend increasingly like let go and was like, I'm not in control. Like the pain is going to come, but I'm not going to call it pain because I've been learning with all my reading that I shouldn't call it pain. Right. And it helps actually that I have 2 older kids. Kids keep you so honest. So at the time, my 2.5-year-old and my 4.5-year-old, they were talking about like how the baby's going to come out. But, kids are very interested in babies, pregnancy. They're always noticed, right? You're out in public. They talk about pregnant women, whether they be pregnant or not. They always have the large bellies, right? So, kids keep it real. So the girls would often say to me, so how's the baby? Like, what's it going to be like? Like, how are you going to know? And they keep you thinking about this thing you're already thinking about anyway. And I would practice the language with them. Well, my body's going to work really hard. It's called labor. Labor means work. I think that's an appropriate term, So like I'm going to be working and then the baby's going to come. They wanted to see videos. I started with an animated video. They wanted to see we watched real videos, which a lot of my friends think I'm insane and my family.
But there's some very gentle birthing videos.
Oh yeah.
That are actually appropriate. It's fine. In my opinion.
I think so. I don't think women have to watch them with their children, but I think women shouldn't judge me for watching them with my children either.
Some children are there when the babies are born.
Yes.
Present in the room. So
people have a lot of opinions about that, Lisa, as I'm sure you know.
They do.
But my girls really wanted to know what was going to happen. And my older daughter, she really loves human physiology. I mean, she just was so into this. So we practiced the language a lot. So I was sort of gearing up, okay, Danielle, the pain is not going to come. The work is going to come. And then I just kept going to sleep every night being like, ooh, maybe I'll be one of those people that wakes up in labor, whatever, who knows. So anyways, Sunday night I go to sleep and I literally, for the first and probably only time in my entire life, my house was just so. This has never happened to me as an adult or a child. My house was just so that Sunday night, which was awesome. That was such a good feeling of like my mind could focus on this baby because my house wasn't a tornado. So my house was just so Sunday night. I had like everything ready. I was like, well, if we go into labor tonight, I'm ready to go. I went to sleep. I probably took another bath. I don't remember. And this birth, by the way, was like about 7 months ago now. So I went to sleep and then I woke up. I think it was 1:45. And I woke up saying to myself, did I have a dream? I was contracting. It didn't feel like a real activity. It just felt like a dream. So I peed And I had no contractions. I was like, well, I guess it was just a dream. So at this point, I'm like, it was after midnight. So I guess I'm 40 and 6, just over my due date by almost a week. And I just went back to bed because I had peed and nothing really happened. I was like, well, wah, wah, who knows when this is going to happen? No big deal. So about 45 minutes later, I woke up again and said, am I having a dream I'm contracting?
Interesting.
And I was like, wait a minute. So then I'm like kind of midwifing myself based on all these podcasts I'd listened to of all these women. I'm like, what would the midwife do? Right? The midwife would say, Danielle, take a shower and it will either go away or it'll be real. So I was like, hey, that's a great idea. So, so I get in the shower and I started contracting in the shower, Lisa.
The shower will do that. It relaxes you. I've had that experience as well. No,
really?
I did. I had the exact experience. Not exact. That's not true. But I was getting at the point that I knew I was in labor, and it was actually like, legitimately like, okay, this is a little bit more uncomfortable. So I was like, okay, so let me go take a shower to relax and it'll help with the pain. No, it actually brought it on. It was like, all right, you're relaxed. Let's go.
Yeah, that's interesting because I also thought they would go away or not be there, and they intensified. I was shocked, totally shocked. And then I was so proud. I was like, I went into labor, meaning like I had nothing to do with it. My body just went into labor. I was so proud of my body. So I took a shower and I tried to relax, and I was surprised I had these real contractions. But they were uncomfortable, but then they went away in between. That was new. That was exciting. And then I decided I'm going to check my cervix because I can. And I never did this with the girls. But I just checked my cervix in the shower because I wanted to sort of gauge how close I might be. Of course, as you'll find out, these things are fallible and people's medical opinions and human opinions are not always the truth. I checked my cervix. There's 3 ways it's judged. It's how thin or thick and how dilated. And the third criteria is how posterior or like far reaching behind versus how anterior or right up front and direct into the vagina. So I checked my cervix and I was reachable. I had been so high in posterior that I couldn't reach it the days and weeks before that. I was anxious to know when I was going to go into labor. So I gently checked my cervix every few days. I did not want to stir the pot. But anyway, for all these listeners who are like, oh gosh, this lady's crazy.
Well, no, but you had the knowledge. So I feel like I would be kind of more afraid to touch it because I don't know what I'm feeling for. Like I know how to feel my cervix for charting purposes, but this is like a different thing.
And truly, I have to be responsible here. Women should not check their cervix unless they have been trained because you actually could break your own water or introduce an infection. I just want to be responsible with that. I have a lot of experience in this regard. So, and my midwife had mentioned around my due date that the head had been very low, which I didn't even notice. And so, which is weird because I felt like I was walking around a head with my first 2 at the end. With this kid, the head was really low, but I didn't even notice until I had actually tried to reach for my cervix and there was a head almost falling out of my vagina for the last couple of weeks. I didn't know that. Anyway, you never know with these things. The body is amazing. So I checked my cervix that day in the shower. It had previously been too high to reach. And it was reachable, but it was still posterior, which means not going to deliver right now. And I was thick. Not super thick, but thick-ish in terms of effacement or thinning out. And I was 3 centimeters. And I thought, hey, look, I think my cervix is changing a little. And I just thought that was cool. And so then I turned off the water and I kind of shouted for my husband, hey, okay, we're gonna go now. So his first thought was, great, we're going to get to the hospital, plenty of time. We transferred to a hospital 30 minutes away, which stressed him out. Because he's like, 3rd baby, 30 minutes away. This could be not good. I don't want a car baby, Danielle. Oh, sure. Yeah, you're crazy. That's never going to happen. So I just told him to call his mom because we had the 2 sleeping kids in the house and she would come over and help us out, which is great. And we got in the car. All said, it takes, 10, 20, 30 minutes to kind of like throw a few things in a bag and like get dressed or, whatever. But we were out of the house in good time. So from the first time I woke up that I thought I was dreaming about contractions till the time we arrived at the hospital, it was about an hour and a half, something like that, hour and 40 minutes. So for that 30-minute drive, I had pain intermittently. I had no pain in between. That was such a relief. I felt like I was working hard, but I didn't feel scared and it felt reasonable to me, which was so exciting. So the big plan was, because I'd had all this sort of hospital baggage with my first two, the plan was to labor down the street from the hospital at a park. It was just right outside hospital grounds, half mile down the road. We'd never been there before, but my OB friend mentioned it to me as she goes walking there sometimes when she's at work, and it's a really beautiful park, like a walking trail and trees. Anyway, it's beautiful. So she said, yeah, it's right there. So we pull up to the hospital and he says, we're going to go to the park, right? And I said, yeah, let's go to the park. So we don't really know where it is. We just follow the road because there's one road beyond the hospital. And we just drive down the hill and there's a parking lot. And so we park the car. I have this thing where I'm like always out of the car before it's fully in park when I'm in labor. So I'm like, I get out of the car and I step a toe on the ground. So now gravity is at play. I've been kind of arching, leaning back in the front seat of the car. And so I step a toe on the ground and instantly this contraction comes over me that was nothing like I'd ever experienced before. You could say it was a tsunami.
Yeah.
Wow, it was unbelievable. It just overtook my body. It didn't feel like the pain I'd experienced with my first two. It just felt like a tsunami. So this contraction comes on and it is so intense. And my uterus is like rocking inside my body. I don't mean rocking back and forth, just like intense. So I start pushing on the front door of the car where I had just stepped into the door jamb. So I start pushing on the door. I think I'm going to break it off its hinges though, because I'm pushing so hard, like counter pressure to the contraction. So then I turn around and I push on the closed back door on the passenger side. And then I'm thinking I'm going to dent the car because I'm pushing so hard on the door panel. So then I fall to all fours on the ground. It was March in Pennsylvania, and it was really cold. It had snowed a few days before, so it was about 30 degrees that night. So I'm on the ground, it's freezing cold, and the ground is ice cold, and my hands are on the concrete, and this contraction comes, and I'm just like, can't believe it's happening. It was so intense. So I stand up, and my husband's like, I think we need to get in the car. I think we should go to the hospital. I thought we'd be there a few hours. Who knows how long? We were going to go for a walk. So as soon as I stand up and he says that, my water breaks all over the place. I'm soaking wet, like waist to toe, through my sneakers and everything, my pants, and now it's still 30 degrees out. So, and I never had the experience of my water breaking other than a medical provider breaking my water. So that was sort of also shocking. Like maybe you thought your water might break. I did not think my water would break. I was shocked. And then as soon as it broke, that tsunami was back even more intense than before. So that contraction came back and I fell to the ground. I could not stand at this point. And I'm on all fours, soaking wet, freezing cold, pushing onto the concrete. Now, there are a couple versions of this story. My husband is now behind me trying to coax me in the car. I'm not moving. He says I'm cursing, like a lot. I don't actually remember that. I don't remember saying a thing, but he says there were a lot of choice words, actually just one word over and over and over again. Who knows what happened?
Imagine what it is, yeah.
It was the choicest of words. So I was like, really? And I asked him how I said it. He's like, no, it was a lot more guttural. I'm like, really? What I remember is being on the ground, being cold, being wet, having the tsunami hitting. And then what occurs to my mind is, and he's trying to get me in the car and I'm not going. And then now he's kind of on the phone with 911 because I'm not getting up. So he's trying to summon an ambulance because he thinks we might deliver a baby. I mean, this is like crazy. It all happens so fast. It's hard to even tell it because a lot happens in a brief period. But I'm on the ground, and from the tsunami, I then realize that my uterus is slamming against the inside of my front rib cage. So I feel the uterus, it is pushing my child out, and then it is recoiling against my ribs. Now, I had never pushed without an epidural in the past, and this wasn't really me pushing at all. It was my uterus slamming the child out of my body. I have since read the medical textbooks that there is this concept of fetal ejection reflex, which occurs in precipitous or short labor. And that's exactly what it was. It was a reflex that my body was doing that I had no control over.
I can attest. I had that experience. I didn't consent.
I have never, tell me about it, because no one else has ever had this experience that I've talked to about it.
My body was pushing the baby out. I did not consent. As a person, Lisa, objected to it. I didn't like how it felt at all, but I felt like I didn't have any control over it. No. It was not like the movies. I was waiting for, okay, push, okay, push, No, it was like full on, this is happening right now.
Was that baby 1 or 2, Lisa?
Baby 1.
Wow. Fetal ejection reflex. What was the total labor time?
I mean, from first contraction.
Yeah.
From very first contraction, 23 hours. But I didn't know that was my first contraction until retrospect. So from active labor, it was like 5 hours.
Right. So precipitous labor is thought to be a total of 2 to 5 hours from first contraction to delivery in the medical literature. But again, I think there's a lot to be learned about normal birth, right? That's what we're kind of discussing.
So did you have your baby in the parking lot?
Well, hang on, Lisa.
This suspense is killing me.
So my uterus is slamming and I realize my uterus is contracting the baby out, pushing the baby out, so then I realized, oh crap, I have to tell my husband. But I didn't want to tell him because he didn't want a car baby, Lisa.
He said car baby. He attracted it.
Yeah. I really felt like bad for him because it was his one request when we transferred hospitals. And I felt like, oh crap, he's going to be mad. Just because your head does stupid things. It's not like he'd, quote, be mad, but that's just where my brain went. Like, oh, I'm going to disappoint this guy who really doesn't want this crazy, dangerous thing to happen. So, I was like toying, oh, should we deliver outside the hospital? He's like, are you crazy? Right. So, this is we're different people. So my uterus is slamming. The next thing I realize after I think I need to tell my husband my body's pushing, next thing I realize is I feel my body crowning. I also never felt that before without an epidural. So I realize I'm crowning, which means the head is now coming out of my vagina between my labia. And my impulse is to put my hand over my perineum, which is the action zone there. And it felt, funny enough, exactly like all the women I've delivered, because you typically do place a hand on their perineum as their baby's head is crowning. And my mind was blown at this moment because I'd felt that on so many women. And it was happening to me totally unexpectedly. It was sort of mind-blowing. So I have my hand on my perineum, the head is crowning, and I'm like, oh crap, I really have to tell my husband, like, this is happening right now. So I said many, many times, he's on the phone with 911. He doesn't hear a thing I'm saying. I said many times, stay calm, like for him, but it's really for me. Stay calm. I have to tell you something. And then by the time I get the words out, I say, the head is completely out. Because that's what happened. So he still doesn't hear me. And by the way, I'm now fully clothed with soaking wet pants, with my left hand on the door jamb of the bottom of my car here, and my right hand on my perineum, with a head delivered through my underwear and pants, but I'm still dressed and everything's wet and gross. So my husband claims he didn't know that all happened and he did not pull my pants down. I also don't remember pulling my pants down. You can all decide who pulled my pants down. Neither of us claims accountability for that. But the next thing I remember after feeling the head and the pants in my hand, the next thing I remember is checking for a cord, because that's just what you do when the baby comes out, Lisa.
Wow. So you delivered in the parking lot.
So yeah. So I checked for a cord.
Or was it in the car?
No, in the door jamb there on the ground, on the concrete.
Wow.
So I checked for a cord. It's sort of like impulse, like you just kind of do what you're trained to do in that moment. So I check for a cord. There is no cord. I kind of frantically keep checking because I'm like, my mind is completely blown. And then I realize, where is my finger? Oh, it's in the baby's mouth. Like, because I kept checking for a cord. I'm like, okay, Danielle, hold it together. Get your hand out of the baby's mouth. There is no cord. You don't need to keep checking. You need to wait for the next contraction. So I did. I'm on my knees with my pants around my knees on the concrete with the baby's head out, with my hands near my perineum waiting for the shoulders, and I just wait for a contraction. And yeah, that's it. I just pulled the baby right onto my chest and I sunk onto my heels. And my husband knew the baby was delivered because he heard the baby sputter a cry, and then he hung up with the 911 operator.
I'm sorry, I just reached into listeners' ear. So you delivered your own baby.
Yes. So it was you hesitate to say this. I'm just going to say it was the best experience of my life. You hesitate to say that when there are other people in your life who might want to share that experience a little more with you, but it was pretty much, unattended. My husband was behind me on the phone trying to help. It was very anime Gaskin, pitch black. We were in the woods. You could see the moon. You could kind of sort of see tops of tall trees, and you could see the light from my car because my car door was open. And I'm holding the baby who sputtered a cry. My husband gets off the phone. And then he just turned into this. He has no medical training. He's not medical at all. He turned into this OB nurse. Oh, just instantly. It was unbelievable. So I had flung my coat off and he says, I'm going to get the coat. He puts the coat on me and the baby because he knows we're cold and wet, which my brain, as soon as the baby delivered, my brain went to mush. I just had no ability to think. And then he said, oh, let me go get the baby blankets in the car because we brought our own blankets to the hospital to sort of protect the baby's microbiome. That was something on my mind. Anyways, so he gets the blankets out of the car and he puts them under the jacket on the baby. And he's like, okay, I'm going to help you in the car. And he just holds my hand and he escorts me in the car. And we went to the hospital and he's like, oh, should we go to the ER? Yeah, I think we're supposed to go in the ER because the rest of the hospital is closed at this time in the middle of the night. And then, he goes to get out of the car and I say, before you go in the ER, you have to take a picture. So then he took a picture of me holding my baby and he went in and got the nurse out of the ER who had some expletives about our arrival and having delivered outside. And that, because like we planned this, we totally didn't. The labor was less than 2 hours and painless, unplanned. The OB also gave me a hard time the next day for having not prepared them for my arrival because I didn't call ahead because I didn't expect to be there for hours. Yeah, so we delivered the baby and then we had anticipated a girl for a number of reasons, sort of like limited ultrasound view, but didn't want to know. And then it was not until I was in the recovery room 20 minutes later after like fighting to get taken out of the ER. They wheeled me to the ER, but they had nothing to offer me. I knew that. So I asked to go to L&D. Anyways, the nurse thinks to check between the legs as she's documenting on the two of us after she gets vital signs. And there was a boy. And so I'm in the room, still connected, umbilical cord and everything, placenta's inside, holding my little cold, wet baby. And I'm cold and wet and gross. And they had to like get all the wet clothes off of me. And the nurse shows boy parts to me by accident as she's documenting for her own nursing chart. And my husband's not in the room because he's still trying to get into the locked unit. It was a whole thing. It's a boy. And then there's this like buzz in the room. It's a boy. Well, didn't you know it was a boy? No, we thought we were having a girl. It's a boy. It's a boy. And then he comes into the room a couple minutes later. Hey, look what the nurse just showed me. And I show him and he's like, it's a boy, And so for days, we didn't know which was more surprising, the fact that we had a boy or the fact that we had delivered our baby outside. So.
Wow. Danielle, that is an incredible experience.
That's our story, Lisa.
Thank you so much for sharing that with us. That there's just so many layers to that. And I wish we had time to like jump into all of them, but I think a lot of listeners will just kind of sit with that. It's a beautiful, beautiful story. And it goes to show, like, I feel like my own little theory on it, babies come into the world however they're supposed to. And often it's not on schedule or the way that you wanted it to be. And so at some degree, I think of birth as this rite of passage it's like a metaphor for becoming a mom because you basically are no longer in control because it's a person that you're delivering and people have their own ideas and thoughts and objectives and directives and all of those types of things. So thank you so much for taking us through that. I suppose we've talked about so much today and I feel like we'll probably have to do a part 2 because there's just so much more to dig into with birth. Based on your experiences, it's so incredible how different your birth stories were, going from kind of just, like you said, like kind of like a regular hospital birth to then delivering your own baby in the parking lot with no medication. Or I think you can hear it in my voice. I'm still kind of like, oh my goodness, that's incredible. But I suppose to kind of, if you wanted to leave the listeners with something from our conversation, all the different topics that we've talked about today, what would it be?
Oh my gosh. I have a general health philosophy that I'll share that I think is related. I really believe that women and men can really rewrite their health story. That is really my belief as a physician. And I find in particular that pregnancy and or lactation for women who are able and choose can be a time of like a second puberty or another health growth phase in their body and in their life. I really think on the one hand, I don't want women to feel pressure around birth because I feel like that really thwarted my efforts a couple times. But also I think there can be some preparedness for moms and dads to choose a supportive medical team and a supportive community to welcome their children into the world. So I would just encourage people to realize that birth is complicated and birth is unexpected. And like you're saying, Lisa, kind of babies have a say in this too. I totally agree with that. And I would just encourage us to be our best advocate and be our best selves, for us to be kind to ourselves and take care of ourselves, and just realize that birth is a bodily experience and we can rewrite our health story. We don't write it autonomously, I don't think. I think our bodies have a mind of their own also, and to some degree. But I just think that health is something where what is that called? The meter can change. I think we can influence our health, and I would encourage women and men to sort of seek the support they need to have a healthy, supported birth experience. Like any health experience I hope we have in our lives.
Well, thank you so much. I think those are amazing words to end on. And so is there, for the listeners who kind of live near you, is there any information you'd want to provide if anyone wants to kind of learn more about you and what you do?
Oh, sure. So I'm at a general medical practice in Central PA. I see adults and children of all ages. I love maternal child health, which is an area that Lisa obviously focuses on. And I love cycles and all this fun stuff. I don't do delivery care anymore, prenatal care, but there's a lot yet about keeping women and families healthy and strong, besides actually getting the baby out of the womb. So we'll leave a link to the medical practice I work at.
Perfect.
And I appreciate everyone who listens, not because of me and my story and how kind of crazy and unexpected that was, but just because I think women who find your podcast are really seeking wellness in their bodies, and their fertility and all that. So I encourage women, and maybe some men are listening, which is so exciting if they are, to just continue their journey. All of us is on a journey, whether we know it or not. So I appreciate anyone being mindful enough to do well on this journey we're on.
Well, thank you so much, Danielle. It's a pleasure having you on the show again. And I'm sure we'll connect again in the future, because when you and I get together, we just chat and chat.
Thanks, Lisa. Take care.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode over at fertilityfriday.com/232. I hope that you enjoyed today's episode with Dr. Miller. Wow, what an incredible birth story. I can't believe Dr. Miller actually had her baby in the parking lot and essentially delivered herself. So what an incredible story that was. Thank you so much, Danielle, for coming on the show and sharing your birth story with us. I feel like there's so many different themes that could come out of that story, and really and truly, we could have extended the episode another hour and unpacked all of that. So I may have to have Danielle back to the show to chat with her more about her experience and just kind of get more in depth what it meant to have those different birthing experiences and how that affected her practice as a doctor. And it's so, it's such an interesting experience. Birth happens in so many different ways for so many different women, but I have to say that was very exciting and it's like something you would hear on TV, but she actually experienced it and lived it and delivered her own baby. So yes, thank you so much for sharing your story with us. And of course, as a mom who's been through birth on two separate occasions, I can't hear a story of another woman's birth without thinking of my own births. And, I thought my first birth was pretty eventful, but I had planned to, for both of my children. So at the time of this recording, my eldest son is 6 and my youngest is 3. And for both births, I intended to deliver at home. And so both of my babies were delivered at home on purpose with midwives. And so if there's a takeaway to take from today's episode, I would say that, birth is a natural process that our bodies are designed to do. Birth is not, inherently by nature a medical emergency. Medical emergencies can certainly arise, but birth itself is not a medical emergency. It is a natural part of life, and it is possible to do it. It is possible to actually give birth and to not require medical interventions at all. And so, if that's the one thing that you took from today's episode, then that's fantastic. Because as scary as it is, and as unfamiliar as most of us are, especially with our very first births, I would say for most women, and of course, this isn't the experience for every woman, but for many of us, our own birth is the first experience that we ever have with birth. I know I had never seen birth before. I have friends who work in the medical field, and so, they have witnessed and seen hundreds, some maybe thousands of births before they had their first babies. But I would say for most of us who do not work in the hospital or delivering babies or, in that type of capacity, your birth is typically the first one that you experience. And so, of course, a lot of fear and doubt arises whether you think you actually have the power and the ability to do it. But yeah, hopefully that's one of the things that has come out of today's episode. And with that said, I just want to thank you for spending some time with us today, for tuning into the show, for supporting the show, sharing with your friends. I really just appreciate the community that is formed around Fertility Friday. If you're not part of the Fertility Friday Facebook group, make sure to join us in there. Head over to fertilityfriday.com/community. And with that, I wish you a wonderful weekend or week, depending on when you're listening to the show. And as always, until next time, be well and happy charting.